One of the questions is, how do we combine drugs in patients with myeloid disorders? It was important because 6 months ago in the US, venetoclax was approved in combination with hypomethylating agents or low-dose cytarabine in patients with acute myeloid leukemia unfit for intensive chemotherapy and they're treatment naive. We were surprised that less than 10% of the audience were combining these drugs. This was important. The practice, I think, is changing. So a lot of questions were about how do we do that? Is it safe? In which population? We've also noticed that some people are combining those drugs in MDS, which is not yet correct or safe, especially in the case of venetoclax. We've also talked about important practice questions. For example, what to avoid, how to dose reduce those drugs in the right setting. How do we treat those patients when they are on multiple drugs? And some of the questions that were not answered, for example, is what is the best way of giving those pills, the venetoclax? Continuous, 3 weeks, every 4 weeks, delay it until later. Should we admit those patients to the hospital versus do it as an outpatient? It just really reflects that there were a lot of questions about the recently approved venetoclax in patients with AML.